The advent of minor ailments in Ontario has really opened the eyes to the public of all the things we can do. I'm really excited about using minor ailments as that stepping stone to introduce us more to the public as a healthcare provider to them and not just a medication provider. Minor ailments is what's going to be the differentiating factor between dispensary and location for healthcare. We've done a lot of this already without actually being able to write the prescriptions. We've been making those recommendations in the pharmacy aisles, using over-the-counter products, or making recommendations to their family physicians. Now that we can actually write the prescriptions for the patients, it's less barriers for them to access their care. I actually had a patient the first week come in for an assessment. The patient said, "I'm so glad you can do this now." Pharmacists can be consulted on and can recommend therapies for anything that a patient needs, and we are definitely a member of their healthcare team. In our pharmacy technicians are often the first touch point with our patients. So the patients coming in and inquiring to speak to the pharmacist, the pharmacy technician will often ask them why and what they need in order to better triage their care. The pharmacy technicians are very important to the flow of the patients and their access to care within the pharmacy. Our technicians are worth their weight in gold, and we'd be lost without them. I think the biggest challenge in Ontario right now in minor ailments prescribing and assessing is working within the narrow framework as it exists, because we are capable and trained to do so much more. I think we've grown more in the last 3 years than in the last 30, so I'm really excited to see what's coming in the future. And I truly believe that minor ailments and its expansion and our ability to assess and prescribe for patients will be part of the future and will be differentiating for those new grads who are coming out, who are fully trained to do this and propel the profession forward. In Ontario, I hope that the future in minor ailment prescribing and assessing becomes autonomous prescribing.